The latest statistics with HIV prevalence in the country. We want to get some meaning and some context to those numbers now. We have Dr. Cherotich, who's the principal investigator at the Ministry of Health, worked very closely on this and has been working in this field for a number of years. Asante sana, Daktari, for making time. Well, let's start with the good news, shall we? Which is we've seen a drastic drop in the numbers over the last 6 years. Doctor, what can you attribute this to?
Yes, thank you again. I think this is a reflection actually of the investment the Ministry of Health and our partners, the US government and also the Global Fund, have made over the last 2 decades. A lot of investments in bringing people to test for HIV and putting people on treatment. And also a lot of investments to do male circumcision programs and other prevention programs in the country. So what we've seen is that a lot of people have been put on treatment. We've seen their viral load or the amount of virus in the blood go down, and therefore the probability that they're able to transmit has reduced drastically. And so I think this is really a product of those investments we've made in prevention and treatment programs.
All right. Can we say we're winning the war based on these numbers?
Yes, definitely, yes. We've come from far. It's always been our aspiration to cut down our HIV transmission. We're looking at 2030 to really control the epidemic. I think these numbers point towards that we're on track towards meeting our goals for 2030.
When we talk about prevalence versus new infection rates, what does this mean? That persons with HIV, perhaps due to ARVs, are living longer? What are those? Just differentiate for us the prevalence and the new infection rates and,
Yes, so the prevalence is basically the number of HIV infections at any given time. So it's like a snapshot. So it tells you at a given point in time. Now, when we talk about the new infections, is that we have new infections happening every day, every month. And so that goes into the pool of the number of people who are HIV infected. So prevalence can go up if there are new infections or people live longer. And prevalence can go down if there are fewer infections or people die, those who are HIV infected.
Okay. Garissa. I mean, some fantastic news there, with the lowest prevalence rates, what, 0.1?
Yes.
So what is this? What's happening in Garissa? What are they doing right? What is it? I mean, I know I've heard people asking, is it cultural practices? What is it?
Yes, what we see in Garissa really is a reflection of many things. First, I think let me discount the notion that there are no HIV infections in Garissa. In fact, as we speak, we have about 1,300 people HIV infected on treatment. It's just that I think the way we do our survey, the numbers compared to the vastness of the Garissa is such that they were so small we were not able to pick them. But certainly I think if you look, let's say, at Garissa town, at their sex workers there, you will actually be able to find HIV infections. But bottom line, yes, there are very few infections in Garissa, and that's good.
Do you know why?
Yes, I think generally it reflects on many things. Generally, we tend to have those regions that have been traditionally circumcising for a very long time, having lower rates of infection. As we know, male circumcision is actually a male vaccine, and so it's protected them. And yes, there may be cultural reasons as well.
Okay. Turkana is also something that's speaking. I think that, caught my interest as well. Talk to us about the rates there. First of all, how much it is and why, what's going on in Turkana?
Yes, in Turkana, I wouldn't really say we are surprised because we have been monitoring Turkana for a long time now. Even as early back in 2010, we were seeing people actually who were coming in to test for VCT, having a lot of very big prevalence of HIV. But indeed, I think now Turkana is opening up since devolution. There's a lot of social interactions, a lot of movements into that region.
Perhaps the discovery of oil?
The discovery of oil, maybe. The refugee camps, the urbanization that's coming in, a lot of those things. But let's not forget the fact that in Turkana also, it's a region that traditionally doesn't circumcise. So circumcision has not gained traction enough to be able to be protective to the people of Turkana. So we have a lot of work to do there. And then also, as we've seen also in the data, There are a few people who are getting tested in Turkana, particularly men.
Okay.
And so those men are not getting into treatment and are not getting viral suppressed. So it's possible there are so many men who are not viral suppressed and therefore spreading the infection.
Homa Bay and many of the other counties in, what was then known as the Nyanza region.
Yes.
It still continues to have, the highest prevalence rates in the country. And this is despite some heavy interventions in this region. I mean, many programs, the circumcision program, was started there as a heavy donor funding. Why do the numbers continue to remain high in this region?
Again, for Homa Bay and their surrounding counties, we are not surprised. That is exactly what we expected. It's actually good news from where we sit, because otherwise it would have gone up. We've seen it actually come down from around 25%, 23%, and now it's at 19%. What it just means is that majority of those people are people who've been already diagnosed, they're on treatment, and they're living healthy lives. So it means we're succeeding in keeping people alive.
Okay, so there's still some
it's a good story.
Okay, it's a good story. My final question, Dr. Cherotich, when all these numbers come out, what would you say to people who continue to feel stigmatized, in this region? Oh, Homa Bay has the highest. Something is going on in Turkana. Garissa has, 0.1%, like you said. That's still indicative that there's a prevalence rate there. But what would you say to people who say, but these numbers continue to stigmatize us, people in Homa Bay or people in Turkana, or how do we interpret these numbers when they come out?
Interestingly, in Homa Bay, we actually have seen the lowest level of stigma. And so that's why people have been able to come up to test and be in treatment. The stigma is actually more prevalent in areas where there is less HIV, and so people come out less to test. But I think the bottom line, whether you're in Garissa, Turkana, or Homa Bay, is that as we speak now, we've made a lot of progress in HIV, in treatment. HIV is no longer a death sentence. We know now that anyone who is HIV infected, as long as they're on treatment and take their medication faithfully, they can live as long as anyone who is not HIV infected. So I think there's a lot of hope and optimism in 2020 about HIV.
Thank you. Good news all around. Thank you very much for that and helping us understand those numbers. Without the context, numbers can be misleading and can get people excited. Thank you, Dr. Cherotich, who's Principal Investigator at the Ministry of Health, breaking down the latest numbers on the HIV prevalence survey. I believe we want to take a break now and then come back with more news for you.